yes, it can prevent the occurrence of these serious complications.
Well, so when should I have this procedure done? What are the steps for that?
Okay. Firstly, we will do a scan of your heart, and there is a certain points we are looking for them, like the degree of obstruction of the heart pumping in your heart, and the size of thickness of your muscular wall of your heart.
Is that the same disease?
Yes.
Okay.
And after that, we can insert the device, and we support you with a certain card. Involving the information of this device.
Okay.
Okay. Are you understanding?
When should I have this procedure done?
My cardiology consultant suggests that we can do these procedures these days.
Carry on and do not bind the screen. Don't bind the screen. We will discuss everything at the very end. Well, thank you, doctor. I appreciate your efforts.
Okay, what's your concern, Mr. Stewart?
Well, this condition runs in families, and I'm worried about my family. I have 2 kids, and I'm worried that they may have the same problem too. Do they need another device like mine?
Okay, Mr. Stewart, I appreciate your worrying and asking. Yes, this condition, it's a heritable condition, and we need to follow your kids with a certain heart scan at a proper age in order to detect the disease early. They don't need this device right now. It's premature to take about this device.
We're not even sure yet about having this condition in them or not. Is there any test that we can do in order to make sure that my children will be okay and they do not have the disease?
Okay, Mr. Stewart, I appreciate your worrying. I just, we conduct a next future visit for genetic counseling, and we will discuss further more about this.
Thank you.
Do you have any concern, please, Mr. Stewart?
No.
So can I summarize to you, Mr. Stewart, please?
Sure.
So you have a certain hereditary disease called hypertrophic obstructive cardiomyopathy, and this disease is runs in family, and it can cause, I'm sorry to say, fatal complications due to abnormal heart beat. And when it becomes symptomatic, we are ready to intervene at this time by prescribing a certain medicines, in addition to a certain intervention like implantation of intracardiac defibrillator.
Thank you.
Okay, can you ask you some personal question, Mr. Stewart?
Sure.
Okay. Do you live alone?
No, with my wife and my children.
Okay. Are you financially supported?
Yes, thank you.
Okay. Do you smoke?
Yes.
How many cigarettes per day?
10 cigarettes a day.
And for how long?
For the past 3 years.
Okay, Mr. Stewart, how this discussion affect your life, please, future life?
This discussion it means that I'm going to have a serious kind of treatment for a serious condition. So if it's troublesome, I need to think about it. And the symptoms that I've been experiencing lately are very distressing.
Yes, Mr. Stewart, but I'm sorry to say yes.
Okay.
Okay, Mr. Stewart. Do you have any concern, please, Mr. Stewart?
No, thank you.
Thank you, Mr.
Okay, let's fight. But the fight is going to be a gentle one since your exam is within a week. So first of all, let's begin with the basic stuff. What is the medical issue in this scenario?
Yes, autonomy,
Medical.
malfeasance, and do no harm, and best of interest.
Those are the ethical issues.
Oh, sorry, medical issue?
Yes.
Oh, okay. He had a serious condition.
This is a 22 years old gentleman who has been complaining of. You will tell me the story in your own words, but you will start the discussion by mentioning the number, which is the age of the patient. You have background echo. Turn this off. Hold on. Okay. So I will start with the number here that this is a 22 years old gentleman who have been experiencing shortness of breath over the past 1 month, and he was diagnosed of having HOCM with a positive family history, for which he should undergo an ICD insertion for the treatment of his condition. What are the ethical issues?
Okay, autonomy, do no harm, and for best interest of the patient.
Okay.
And no justice here. Justice.
Issues here are the patient's autonomy. He has the right to know everything about his condition, his diagnosis, his management plan, and he has the right whether to accept it or refuse it. Keep it simple in one word. Beneficence is to do only good to the patients. Avoid malfeasance is to avoid harming the patients. Justice, all equally, regardless. So we are treating all of our patients equally, regardless of their age, color, sex, or religion. Agree?
Agree.
So 4 ethical issues, and those are the same in every case. And communication. What are the legal issues in your scenario? You need a consent for this procedure.
Yes. Yes.
Did you tell him anything about it?
No.
What does he do for a living? What is his job?
Yes, driving.
What if he is, what if he's a taxi driver or a bus driver or he's driving his own car? So driving also is a legal issue in this scenario. So back to the case. Tell me about this gentleman's circumstances, his job and his smoking. He's a smoker. Would you like to do anything about that? Should he stop smoking?
Yes.
Did you offer that to him? Did you offer any help regarding that?
No. Okay.
Regarding the implications of this problem, you did ask about the implications of this problem and this discussion on his life. And he told you that he's pretty much affected by that. How would you help him out with those problems?
Okay. What can I say to him about implications?
How would you help him out?
Hello. 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 Hello.
Your voice is clear, doctor.
Okay. Hello.
Sorry for the interruption. Zoom is going nuts. Are you able to hear me now?
Yes.
Okay. So back to the case. let's agree that some points are missing and we need some attention in order to tackle this properly. So first of all, let's focus on getting things in order. Similar cases are very common in the exam and we need a proper approach. So we have an introduction for all cases, and those are essentially the same points. And those are the points that you have mentioned. Introduce yourself, confirm the patient, confirm the agenda of the meeting, take a permission to discuss that. Would you like anyone to attend the meeting with us? How much do you know about your condition? And do you have any expectations? Always, please find out the expectations or ask about the expectations of the patient. Expectations regarding the meeting, expectations about the disease, expectations about whatever. So do you have any expectations? An open-ended question. Following? Dr. Mustafa?
Yes, with you.
Okay. The second step should be breaking a bad news. Breaking bad news goes in a very simple manner. You have to give me a warning shot, and you have done that, followed by silence. Give me time to absorb what you have said and to prepare myself. Then you will break the bad news. Then you will completely go into silence. With all due respect, you will shut up and you will maintain eye contact and be always ready to offer any kind of help and support, tissues, water, or whatever. This is the way to break the bad news, and we have done that essentially okay. We will discuss step by step now. Then I need to tell him about his condition. So I will start by the definition of his disease. This is standard for any case of counseling of any chronic disease. Let's agree from the very beginning that one of the doctors did mention that already before you did start, that this is counseling for HOCM along with a procedure discussion. So I have 2 points here to consider, the HOCM and the ICD. So then following the definition, I will need to draw something for this patient, tell him about the clinical picture and complications. Then I will need to give him treatments, which is the ICD, but I always take before I give. So I will take his history before I give him anything. Then I will offer him the treatments. The treatment in this condition is the ICD along with something missing in your discussion. But let's carry on with the ICD. The ICD, the points that we need to discuss are why this device is needed. What if not done? What will happen to this patient without this device? Then the device will be inserted through a procedure. This procedure, I need to know who is going to perform this procedure before, during, and after the procedure. I need to know about the complications of the procedure. Alarming signs of the procedure or after the procedure when the patient is home. I need you to tell me about the consent for this procedure, and I need you to check my verbal feedback to check if I have something in mind. And after the treatment, we always follow up with follow-up and precautions. And at the very end, we end up with a closure. So if we take a closer look now at the case, Dr. Mustafa, you can tell that this case is 2 parts. The introduction and the closure are the standard part of it. In between the introduction and the closure, we have a discussion regarding the disease, which is the part in green, the HOCM, and we have a discussion regarding the device insertion, which is the part in yellow. Following?
Yes, follow you.
So the whole thing is no paragraph approach, just points. And I should write those points down in my paper before I see the surrogate in order to be able to cover it properly and not to forget any. So let's do this one more time. Introduction checked, and we need to make sure that we are exploring his expectations. Breaking bad news checked. Definition usually in 90% of the cases is either going to be a familial disease versus an autoimmune disease. this is a familial or a genetic disease. I need to draw something for this patient. I need to tell him about the possible clinical picture and the complications. Generally speaking, regarding the complications, we usually say that this is potentially life-threatening. Why do I need to mention that this is potentially life-threatening? Because I will be using that whenever the patient is refusing any offer that I'm giving to him. History-wise, for whole life, I need to cover the social history, the past history, the medication history, and the family history as well. Why? Social history is to offer help. Past history. Dr. Nippon, if you kindly please mute your mic. And family history in order to discuss that familial condition with him. The ICD, why needed to control or to prevent complications. What if not done? You may suffer complications, and unfortunately, those can be potentially life-threatening. And this is what I have mentioned in the very beginning. The procedure, who will do this procedure? A professional team who has done this procedure multiple times before. Please do not say hundreds of times or thousands of times. Irritating for the examiners. Yes. Then, before the procedure, we will be making sure that you are fit and ready for the procedure. During the procedure, we will numb your skin with a needle that feels like a bee sting. Then we will insert the device. After the procedure, you will be kept in hospital for a short duration of time to make sure that you're recovering nicely with no complications. Regarding the complications and the rest, we will address it after we do this. So if we took a look at that approach, we will say that we have 12 or 14 steps to consider. And those should be covered in 12 minutes plus 2 for the concern, meaning that each step will take at most 1 minute. So this is a discussion, you and the surrogate. So each of you will get 50% of the time. So you will get 30 seconds per step. So it is of paramount importance to manage your time. The only way to manage your time without losing any points is to have it written in front of you. And that's why I'm always focusing on the 5 minutes before seeing your surrogates.
It's acceptable to write it?
Of course, and you told me that in the very beginning that you will be writing notes in your paper that you had already 5 minutes ago. So yes. Then, moving on. So the procedure, who will do it? Before, during, after checked. Regarding complications or side effects of a procedure, of a medication, of whatever, keep in mind that I do not care about a single case, never, in whatever station. I care about the approach the most. Because having the approach properly done will enable you to tackle whatever case in the exam rather than giving you one case saying, well done, and clapping my hands for you. So, complications, always put it in 3 points. First, we need a reassurance. Then, I need you to enumerate them for me. Then, reassurance. Why do I do it in this manner? Because I want the patient to do the procedure. If I come to you and I tell you, Dr. Mustafa, this medication has a lot of side effects and it can precipitate a stroke, would you ever consider taking this medication?
Okay, I should tell him about the complication.
You will tell him about the complications, but you have to tell him about the complications in this manner because you want him to take the medication. Again, for example, if I have a medication A, and I'm going to say to the patient that this medication is going to kill you as part of the side effects, he will never take it. But if I mention it to him that this medication is very beneficial, but it has some side effects, unfortunately, rarely it may precipitate death. However, we will do our best to help you out. This way, he will take it. You get the difference?
The same thing for the procedures.
Exactly. It is the same principle. So, reassurance, this procedure, like any other procedure, has some side effects or some complications. However, those are minimal, in the hands of a good team. Complications of any procedure, standard for any procedure, are 4 points: infection, bleeding, internal organ damage,
Hello?
and failure.
Hello?
Yes. Anyone having problem with my voice? Can anybody?
Okay, I missed a few words, please. And the blue color.
Okay, so enumerate the complications for me: infections, bleeding, internal organ damage, failure of the procedure.
This is general complication for every procedure.
And well, exactly. And you will add specific complications for specific procedure. For example, I have a lumbar puncture, I will add a headache. I have a nephrostomy tube, I can add hematuria. For a case of ICD, the most likely complications are the general complications of surgery, apart from the complications from inserting the device being malfunctioning or requires a repositioning. Then the reassurance. This is a very important part, that this patient will be kept on regular follow-up. F equals an F. Follow-up is the full mark. So we will keep you on regular follow-up to make sure that you are getting along with the device and you're receiving the best of care. So fast forward mode, Dr. Mustafa, 30 seconds. Go. Dr. Mustafa, are you there?
Hello, Dr. Muhammad. Sorry, I didn't hear.
Yes, I want you to think about the complications of the procedure under 30 seconds. Can you do that?
All right, Mr. Stewart. I appreciate your worrying. So this procedure can cause certain complication like bleeding, infection.
Where is reassurance first? Reassurance. Enumerated reassurance.
Sorry. This procedures is like any other procedures. It could have a minimal complication.
Some complications which are minimal in the hands of a good team. Minimal with a professional team.
Minimal in the hands of the good teams.
And it includes?
Yes, this procedures had a minimal side effect, especially in the hands of the good team.
Mm-hmm.
Like infection, bleeding, malfunctioning of the device, and what's the third complication?
Infection, bleeding, internal organ damage,
and malfunctioning.
And
malfunctioning of the device.
Or failure procedure.
But we kept you on regular follow-up.
Yes, carry on.
To assure that the device is functioning well and there is no complications.
Thank you. How much time did that take? 30 seconds.
20 seconds. Yes.
This is what I want you to consider in every step along the way. Following the complications, we have alarming signs. What are the alarming signs? Those are the signs that if the patient starts to suffer any of those after being discharged home, to come back urgently for an urgent review. And those are fixed for whatever procedure. Those are disturbed level of consciousness.
Yes.
Fever, persistence, pain, or bleeding. Pain and bleeding are common in any procedure, but being resistant is not common. So, Mr. Stewart, after your discharge home, I want you to know if you are suffering from any of those conditions. Please report back to us immediately. Like any disturbed level of consciousness, high body temperatures, or if you still have severe persistent pain or bleeding, please do not hesitate to come back. Easy?
Easy.
Under 20 seconds. Applicable for the exam. I am being super realistic in station 4. Moving on. Then comes the consents. Before we start with that, what are the criteria for the consents?
Please, Dr. Muhammad, can you send me this in PDF if you can?
You can find it on the Telegram.
Okay.
You can find it on the Telegram. I will send it on the Telegram and the WhatsApp groups. So what are the criteria for the consent?
Okay. Explanation of the procedure.
What are the criteria for the consent? Okay, so this patient should be fully informed, or there is a fully informed consent. Should be competent. Volunteer, and he has the right to withdraw this consent anytime before the procedure, the continuity of the consent. So if you want the full mark for clinical judgment, please tell the patient about each of those during your discussion under 30 seconds. How to do that? Very easy. One, let's put this in red colors. So before the procedure, Mr. Stewart, we will need you to sign a consent. Consent is not jargon.
Okay.
Consent is English. It's not a paper. It's not a toilet paper or a yellow paper. Consent is not jargon. This consent will contain...
So, Mr. Stewart...
hold on. Let me do this once, then you'll do it for me. All the information that you need to know about the procedure with the possible complications. Take your time. Read it carefully. Sign it when you feel ready. And you have the right to withdraw it anytime before the procedure. Fast forward mode. Before this procedure, Mr. Stewart, we will need to sign a consent. This consent will contain all the information that you need to know about the procedure. Please take your time, read it carefully, think about it. Sign it when you feel you are ready for the procedure. And you have all the right to withdraw this consent before having the procedure done. Now, your turn, Dr. Mustafa. Tell me about the consent under 30 seconds and take the full mark.
Okay, Mr. Stewart. This is the consent which is contain all the information about the procedures. Please take your time and read it carefully and sign it when you are ready. You can withdraw it after completing your reading the consent.
And the last point?
You can withdraw. Okay?
Yes. Anytime before the procedure.
Okay, you can withdraw at any time before doing the procedure.
Thank you. This is the consent under 30 seconds, so it's doable for the exam. That's the mark. This is the full mark in clinical judgments. Then moving on, the last point is going to be follow-up and precautions. Follow-up being the full mark, F again equals an F. I will need to repeat the full mark over and over again. So we will be keeping you on follow-up. We will be keeping you on follow-up. Do not get tired of saying follow-up. I want you to tell the examiner about it. I want him to hear it. Then comes the precautions. What are the precautions? Precautions, you have precautions for both HOCM and for the IT. Precautions for HOCM. This is the missing piece in your discussion. When you told me about the disease, let me draw you a drawing. Okay. This is your heart. It's composed of 4 chambers. And there is a tiny timer here that controls the electrical activity. Unfortunately, you have this disease called HOCM, which is affecting this part of your heart, causing obstruction of the blood flow and disruption of the electrical activity. So when it comes to HOCM, please remember the plumbing issue, سباكة, and the electrical issue, the electricity, which can potentially precipitate life-threatening complications. I'm sorry to say that. So this is how to get him to know about the condition, the definition, drawing, clinical picture, complication. This is the full mark in clinical communication under 30 seconds. Easy?
Okay.
And the precautions will be based upon those, because the obstruction, this gentleman should avoid heavy exercise or whatever kind of hobby that will involve a vigorous exercise, not to precipitate a fatal attack. And the electrical activity, this patient should be away from any stress, because highly stressful conditions can precipitate acute arrhythmia.
Yes.
Make sense?
Yes.
This is one. Regarding the ICD insertion is a very simple procedure. It is done as an outpatient in which it is composed of two parts. This is a battery, the device, and this device has two leads. Those two leads are attached to the heart, but they are not actually touching the heart.
Also drawing?
Just, sorry?
Also drawing the device?
Does it take any time? 2 seconds. This is the device on the screen. Drawing will make life much easier and much faster for you.
Yes.
This is for us to understand. So this is a procedure in which we apply this device and those two wires to be next to your heart, not into the heart, just near to the heart. And it is usually under the collarbone, under the clavicle. Other forms of device do exist in the axilla, but this is the most common one. And this is the most common device. Whenever this device senses, this is for us to understand, senses an arrhythmia, it shocks the heart. So the sequence of having Hocum collapse, this patient is a normal rhythm. I want you to imagine that. Then because of the Hocum, he will go into a VTAC or into a VF. This in turn will decrease the cardiac outputs, which will in turn cause cerebral hypoperfusion and causes loss of consciousness. The device will sense it, so the device will shock the patient. So it will maintain the normal rhythm again, and the patient will recover. This implies that this patient is still likely to have loss of consciousness even with the device inserted. So this patient is not to drive, at least for the first 1 week after the surgery. Make sense?
Okay.
So that's why the precautions here are very essential, because you have precautions for the Hocum itself, because most cases in which there is a Hocum or they are choosing a counseling of a disease, they are targeting professions that can endanger the patient's life. They target activities that will affect the patient's survival. So if you ask me about my profession, I'm a bus driver. What do you do for living? I'm a bus driver. What are your hobbies? I like mountain climbing. I like cycling, hiking, wrestling, swimming, all the activities that can kill me. So you need to give me advice about that. And regarding the device, you should tell the patient that he should refrain from driving at least for 1 week. It should be 1 week for a private car and at least 2 weeks for any public or type 2 vehicle license. You should stop driving till at least your condition is reassessed and you are fit and okay to carry on with the driving. Then comes the closure. That was a missing piece in your discussion. Closure, 7 steps. And again, I am putting the number before I open my mouth. So I will start with a concern. Do you have any concern? I will answer it. Do not step to the next step until you finish it. Again, do you have any further concern? When he says no, I will move on. Then I will go for the summary, which should not take more than 20 seconds. Then any further concerns? Would you please tell me how much did you get from our discussion? I want you, Dr. Mustafa, to replace the word "do you understand me" by "are you following me?" Do you understand me essentially means that I'm student. You do not want that in the exam. So are you following me rather than understanding? No, it's not about being sorry, man. We are doing this for you to pass. You have an exam next week, pass it. Then the next point should be concern again. Then offer me some help for any case of station 4. And those are brochures, leaflets, websites, along with your hospital contact number in order to contact me if you have any further question or queries. The hospital contact number, not your personal contact number. Otherwise, your wife will kill you. وكلنا عارفين الموضوع ده.
Yes.
مفيش حد فينا كبير على الموضوع ده. Then comes the last point, which is the concern. So if you take a look at that, you will see that we did start with a concern once, twice, 3 times, 4 times. So I am 200% sure that I did not forget any concern. And I am 200% sure that the examiner did hear me ask about the concern. And by starting with the concern, I am giving myself enough time to reply to those concerns. Most of the time, I have 2, 3, 4, 5 concerns. So I will start with it because the examiner cannot tolerate not answering a concern, but he can tolerate not me offering help, but not the concern. So this is the priority here. So this is in general how we should tackle a case of chronic disease counseling in disease counseling along with a procedure. Whatever is applicable to this case is applicable to whatever case of diseases or a procedure. And that's why I do not care about a single diagnosis. It's all about approaches, how you think. Then comes to the concerns. Dr. Mustafa, I did ask you if I'm going to die. What should be the proper answer?
If you're going to, after doing the procedures or not?
Now, am I going to die after being diagnosed of HOCM?
Mr. Stewart, I appreciate your feeling and your worrying, but if we control the disease by putting this device, it will prevent the fatal complication, and so it's a premature.
Are you sure about that?
Not.
No, you're not sure.
No, sure. I'm not sure.
There's nothing in medicine.
It's 100%.
100% sure. So how to tell that to the patients when he's asking you, am I going to die? When he's asking you, how much time do I have before I die? When he's going to ask you, am I going to get better?
Okay.
Or please give me some hope. Standard is concerned in whatever kind of case. The answer to that, I'm not sure of. I do not know.
I am
but
not
instead
sure
of saying that I do not know, I will play the game of communication. What is the game of communication? 3 simple points. I appreciate. Tell me the negative idea, then tell me the positive idea. I appreciate your concern. I'm really sorry regarding the terrible news. I can only imagine how bad the situation is. Very easy, standard kind of sympathy. The negative idea that this is a serious condition and it can potentially have potentially life-threatening complications. This is the bad idea or the negative idea, the sad idea. The positive idea is that we are going to do our best to give you the best treatments, keep you on regular follow-up. Again, F is an F. Always maintain the follow-up. Follow-up to make sure that you are getting the best of care. I did not say that getting the treatment in order to heal you or to get better or to be healthy or to get rid of the disease. I do not make any promises. I did not specify a time frame. I didn't even reply to him yes or no. This is the full mark for this concern. I am a good doorman. Does it make any sense?
Okay.
Okay, let's try this with you one more time. Dr. Mustafa, I am diagnosed with HOCM and I am so worried that I'm going to die. And I'm asking you, am I going to die? What should be the answer?
Okay. Hello. Hello.
Yes, carry on.
Okay. I appreciate your worrying, Mr. Stewart. I don't know. I'm not sure.
You are not going to say that. You are not going to say anything about that. You just start from step 1.
Okay, what's about? I forget the first one. What about the first one?
Appreciate.
Yes, I appreciate your feeling, Mr. Stewart. This condition has a serious life-threatening complication.
Mm-hmm.
But
yes.
if we put this device with medical treatment and regular follow-up, we can prevent the occurrence of this life-threatening complication, Mr. Stewart.
No, we cannot prevent it. You are not sure about it. All you are going to promise the patient is that you are going to do your best with no promises regarding his condition to improve or not. You may insert the device and the device fails and the patient dies. No guarantee.
How can I say it?
It's simple. Again, I appreciate how worried you are. Or
yes.
I can only imagine how stressful that is for you.
Yes.
Or
yes.
I'm really sorry regarding the terrible news. Unfortunately, having HOCM is a very serious condition with potentially life-threatening complications. Nevertheless, Nonetheless, however, we are going to give you the best treatments, keeping you on follow-up to make sure that you are receiving the best of care.
Okay.
Again, try it again.
This is the
Am I
best
going
care.
to die, Dr. Mustafa?
Okay, Mr. Stewart, I appreciate your feeling, but okay, Mr. Stewart,
Yes.
I appreciate your feeling. This disease has a serious serious life-threatening complication. But if we do our best by putting this device with medical treatment and we
Forget the device. Give him the general idea that you are going to do your best.
We are going to do our best for the treatment and with a regular follow-up. Okay.
We will keep you on regular follow-up. It is as easy as that. Do not complicate things. It's straight away, flat, easy. So this is regarding.
After saying a regular follow-up, what can I say?
You're going to tell him this is a serious condition with potentially life-threatening complications. However, we will do our best in order to give you good treatment or the best treatment available, keeping you on follow-up to make sure that you think the best of care.
The best of care. Yes.
Standard kind of answer. So, what did we do? One, we did make appropriate approach regarding the case. We did target how to organize the paper. We did target how to answer the concerns. We got to discuss the simple points of the medical, legal, and ethical issues at the very end. Do you agree, Dr. Mustafa?
I totally agree.
Okay, so overall, well done, my friends. We just need a little bit of a confidence boost and things should go the way you want it, inshallah.
Can I proceed with my exam next week, Dr. Muhammad? I am really feeling from the station.
No. It's not that bad. It's not that difficult. Simply speaking, those points that we have discussed are something like 60 to 70% of any case. Just to master those points and to consider practicing those daily till your exam means that you are inshallah going to pass. It's not that difficult. Have the confidence, go for it. سيبها على الله وخلي الوالدة تدعي لك زي ما بتدعي لنا كلنا. عادي يعني.
الله يوفقك إن شاء الله.
Okay. ربنا يخليك. ربنا يكرمك. Okay. Any question here, anyone? I want to share something here with you before we wrap this up. And that is coming up on the screen.
Dr. Hassan, regarding his concern, my children will have the disease, should I discuss genetic with him?
No. Why? What do you do for a living? What is your job? What is your job?
Who? The patient?
You.
Or me?
You.
Doorman.
Thank you. You are a doorman. Meaning that this is not my thing, not my specialty. I am worried about my children. I'm sorry regarding the stress, or I'm sorry regarding the terrible news that I have for you today. Unfortunately, your children have 50% chance of having the same condition. And for further testing and assessment of that, we can involve in the multidisciplinary team who's going to take care of you, the genetic counselor and the heart specialist. They will be in a better position to discuss how they can trace your heart, trace your children's heart, or to decide what are the appropriate steps to be done. Okay. Any other question? Yes, sir.
Yes, Dr. Muhammad. Dr. Muhammad, if he asked me, am I going to die, doctor? What if I will tell him, I appreciate your concern, but I am sorry to tell you that your condition is life-threatening if it will be untreated. But by this procedure, it will minimize the possibility and will help you to avoid any life-threatening condition in the future. What if I will?
That's perfect. We do agree on the principle. The principle here is not what you're going to say. It is the idea that you are delivering to the patient. So by saying that, you have shown sympathy and you have told him about how serious the condition is In other words, you did not give him any false hope. This is the value of mentioning the negative idea. And when you mentioned anything about the positive idea, you did the reassurance. So this is the concept that we do agree that you should deliver to the patient. And you have said essentially the same thing with your own words. I do not mind that at all.
Sir?
Thank you so much.
Yes,
Muhammad.
thank you,
Dr. Muhammad, I have one question.
Yeah.
For ICD, how can explain the patient that this is battery connected to 2 wires will be near your heart and will pick up any abnormal heart racing and then will give you electric shock like this?
Hokam is troublesome for some of us to explain because everybody is usually missing the electrical part of the Hokam. Hokam's main cause of death is the arrhythmia, not the obstruction of the flow. So again, this is your heart composed of 4 chambers. This part is affected by your disease. This can disrupt the electrical activity and it can obstruct the blood flow. For that reason, we will need to insert a device. This device will be connected to 2 leads surrounding your heart. It can sense any disruption of the electrical activity and it will deliver a simple shock in order to restart the normal heart rate.
Okay,
Thank you,
sir.
second or less. So it's a straightforward one. Thank you, doctor. Yes.
Sir, if he says that, is there any medications for this? Why are you going for ICD?
Thank you. This is a very good question. This is the question that I asked Dr. Mustafa. Is there any other option of treatments? Yes, there are other options of treatments. However, what do I do for living? I am a doorman, so I am following the building owner. I am always following my boss, the consultant. The consultant said ICD, so it is going to be ICD. So is there any other option of treatment? Well, I appreciate you sharing your ideas with me. In fact, there are multiple options of treatments. And this is a fact. However, ICD is the best treatment for your condition, as decided by the MDT after fully assessing your case. So I did not lie because there are other options of treatment, and at the same time, I stick to the consultant's decision.
So my answer was false.
Besides, some patients, even with the ICD, your answer was not right. So some patients with the ICD still take antiarrhythmics. So yes, it can be given, but who is going to decide that? Me, the doorman? No. So I will stick to the fact that the consultant thinks that this is the best option for you. Always keep in mind that the consultant in your scenario is the building owner. He is your boss. And he is the same person as your examiner. Examiner is a consultant in the UK. Shoot.
So we have to tell him all the medical treatment options and then...
No.
We should stick to the
What I have said was very simple, straightforward. Stick to the target. So you will appreciate his question. Then you will tell him that there are some other options. You are not going to discuss any of those because ICD is the best option for him.
And if he insists and asks for other options?
So he's refusing the medical decision. How do you deal with a refusal? I did discuss that yesterday or the day before. How do you deal with a refusal? Can anybody guess?
Why?
Why? How many steps first? Those are 4 steps for any refusal. Benefits, complications. If this is not helping, go to the consultant. So why are you refusing this procedure? If there is anything that you can offer help for, you will. Otherwise, you will move on to the next step if he's refusing the benefits of having the procedure done to give you the best of care and to help you. If he's still not convinced, I'm sorry to tell you that there is potentially life-threatening complications, the one that I have mentioned from the very beginning. If he's still not convinced, I appreciate your worries. I can arrange a meeting with my consultant. He will be in a better position to discuss that with you. And that's the end of the discussion with the examiner, with the surrogate. I'm not fighting with him, not forcing, I'm not accepting his refusal.
In the introduction, sir, do we have to say that what do you know about your condition and what are your expectations out of this discussion?
not of this discussion, expectations in general. Because he may have expectations from the discussion, he may have other expectations from his outcome of the disease or the investigation results, he may have an expectation regarding anything in life. So since you are exploring his expectations, which you have no idea about, keep it as an open-ended question. Do you have any expectations?
Okay. Okay.
Here. Again, let's take a look at this, and I do not care about whatever the case or the scenario is. I care about what the examiner has written down. Here, clinical communication skill. This is the first skill assessed by the examiner. And here he has given a satisfactory. This is a full mark in clinical communication skill. Why? What was the first word written by the examiner? Explore. So you need to explore. And he ensured that he is there. Version 2 is the correct one. May I confirm that you're Mr. Stewart and you're 22 years of age? Yes, I am. So proper introduction makes a lot of difference. Then the next part, or the more important part here, which is why this is a full mark in clinical communication. He mentioned that specifically at the very end in the same paper. What did he write down?
Explain with drawing.
Thank you. So drawing is a full mark in clinical communication. Straightforward. Does it make any sense?
Sure.
Sure. Moving on. This is another case. I do not care about the case. This is a case of a procedure, regardless of the procedure. Clinical communication was terrible. He said unsatisfactory. He said blood conduits. Blood conduit or blood conduit. Do not mention blood conduit or blood conduit. This is not my feedback. This is the examiner who wrote this down. Moving on. The second point, no exploration. So you can tell the first feedback, explored. The second feedback, no explore. Cannot get any clearer than that. Moving on, whatever he wrote down, then came to the point of clinical judgment. This is a fail, unsatisfactory, fail. Why? Did not check an informed consent. Missing the consent is fatal. It does not mean that this doctor was bad. It means that this doctor was either not knowing what she should discuss, or he was under a lot of stress. So please write down your paper, and you will find that you have written down the consent in front of you in order to remember it inside. Are we on the same page? It's not missed totally. This is the value of the practice. Now, if you have this case in the exam, you will ace it. You will get the full mark. Okay, any other question here?
Please, Dr. Muhammad, can you mention what? Please, can you mention 6 points of introduction firstly, Dr. Muhammad?
Introduce yourself, confirm the patient, confirm the agenda of the meeting, and take permission for that. Would you like anyone to attend the meeting with us? How much do you know about your condition? Do you have any expectations? I'm going to send that again in the PDF in the Telegram group. You can find it very easily organized there. Anyway, that was a good discussion. Thanks, everybody. Here is a shout out at the very end to the book of communication. This case and similar cases are also discussed in that. And tomorrow is a new
Dr. Muhammad.
day, new start. And I want you to share with me the cases that you think are difficult for you to handle or to tackle on your own. Yes.
Dr. Muhammad. Assalamu alaikum.
Yes. Alaikum salam.
Dr. Muhammad. أنا دكتورة هالة حمودة. Please, can you check your
أهلا دكتور
WhatsApp?
هالة.
There is a good news there.
نجحتي؟
Can you please check your WhatsApp?
You boss, say it. ما شاء الله, مبروك.
Yes,
When?
yes. Yes, from the first
MashaAllah.
attempt.
ما شاء الله, ما شاء الله.
And please check your WhatsApp.
Okay.
Thank you, Doctor.
باشا انا هعمل لك حفله. Thank you. Thank you, doctor. That's a good news. بشرة خير يا دكتور مصطفى. Okay. Thanks everybody. I'll be seeing you tomorrow inshallah with success. See you tomorrow inshallah. Assalamu alaikum.